This is Pat Salber with Health Innovation TV here at Datapalooza in our beautiful nation's capital. And I am really excited about this panel. I have three incredible people with me who are all working together on an innovation called Crowd's Cure for Cancer. And I'm going to turn to Abdul Sheikh, who is, as he said to me just a minute ago, the cancer guy, to have him explain to us what this is all about.
Thank you. So I'm Abdul Sheikh, and I'm a program director at the National Cancer Institute. And I'm just really excited to be here because we announced yesterday the 3 finalists for our Crowd's Cure for Cancer Challenge. And this challenge really focuses on a difficult problem that we face here in America and worldwide, really, which is as patients who have cancer transition from specialist care to primary care, they face a lot of difficulty and burden in managing and coordinating their own care. So figuring out which providers to go to, tracking their medications, tracking their symptoms, really trying to integrate back into their lives after they finish treatment. And
they're making these decisions when they're probably really frightened.
Exactly. They're tired. They've been through an ordeal just going through treatment. And really, through early detection, through better treatment of cancer, we're getting better outcomes and more survivors. But this challenge focuses on, okay, now that you've been through treatment, how can we help you integrate back into your lives? And what we've been looking for is how do we show innovators out there, here's what we know about helping patients get back into their lives, coordinate their care, communicate with their providers, with their care networks. We'd love to see what kind of innovative applications can come out from the crowd and really help address the needs of cancer survivors with this challenge.
That's great. This is really a marvelous idea. Adam, I think I'm going to ask you next because, and this is Adam Wong from Office of the National Coordinator, and he's the challenge guy. And so I'm going to pass it over to you. I'm actually going to let you have the mic and tell us a little bit about how ONC is involved in all of this.
Thanks, Pat. I'm Adam Wong. I'm the program manager for ONC's Prize Challenge program, and we're really excited about doing these challenges. We've done a number of them over the past 2 years. Our first one, in fact, was with Abdul and NCI, and we're really excited to be working with them again. Challenges allow us they give us a number of new options for spurring innovation. We can kind of shine a spotlight on issues that we feel need more development, or we don't feel that the solutions that are available are really hitting the needs of of people who can use these types of apps or programs to manage their health. One of the things that we really like about this particular challenge is that we've integrated the crowdfunding aspect with the MedStarter platform, and we feel that the finalists that we've selected are really in a position to take advantage of that and gain a lot of benefit from it.
Fantastic. So I think it's fair to say that the ONC has become an innovation machine.
I would love it if people said that.
Okay, fantastic. And so, Alex, I'm going to have you say a few words about yourself. This is Alex Fair, who's actually my buddy and my competitor, and we do a lot of things together. Yes. And Alex, I know that you've been so excited about this challenge, and you're always trying to put the iPad in my face to show me, this wonderful competitor and this wonderful competitor. So what I want you to do is just to say a few words about some of the really interesting innovations that are on your site, and then announce the finalists.
Okay. Hi, I'm Alex Fair. I started medstarter.com. And what we really love about what it enables people to do is that it allows people to get up and stand up for what they care about, the care innovation. The Crowd's Cure for Cancer Challenge it's a really exciting idea because there's not a lot of things out there. I mean, I had never seen a cancer survivor app before. I don't know if anybody else had. I think I know the space pretty well, but I hadn't seen anything that was out there that was really doing a good job of it. And then so we threw down the gauntlet on this, and suddenly, with the help of Health 2.0 and Zanate Media and a lot of great partners, Live Strong and the American Cancer Society and Stupid Cancer and Cancer 101. They spread the message to everybody. And HIBC TV, or Health Innovation TV, has been extremely helpful as well. And they spread the message to over 1 million impressions on Twitter. And we got 30 great applicants. Companies I never heard of, and some companies I had heard of, but didn't know that they did this. And they made new versions of their platforms just for cancer survivors. There are some doctors who got involved. And there's 3 really great finalists now on medstarter.com that are all about cancer survivors, whether it's making a care plan like my care plan from a company called Journey Forward created. Really, its company's been around for a while, but they wanted to make their next interactive version. Another one is called Patients with Power, and I just love that name. And that was started by a caregiver whose wife got cancer, and he wanted a better way to deal with participatory care planning. So where the doctor and the patient are both part of what's going to happen. And also with the use of guidelines from NCCS that would allow people to see what the best ideas are. And the third one, which this is where that AMVIT app would come in really, really handy. The third one is called Together, right? Which is by a company called Medable. And Together was started by Michelle Longmire, an MD in San Francisco. And she saw the same problem. And she wanted to design and build a really great app. And she made a very beautiful, very user experience friendly application, which she calls Together. Really nice looking thing. So that's what we're doing. And people are coming to the site, they're finding it, they're starting to fund it. But it's all driven by the ONC problem set that they defined, that they saw a problem that needed to exist. So, yes.
So I'm taking the mic back.
Don't give me the mic again.
I may. And so that was great, Alec.
Thank you.
And I'm excited because you've been so excited about this project. Abdul, tell me what you think about these winners.
I think Alex said it really well, that we had 30 amazing entries who came in within a relatively short span of time, about a month for phase 1. And to have 30 entries come in and really put in some hard work, our judges had a hard time, and you mentioned some of the organizations that our judges represent. So we had representatives from Livestrong, American Cancer Society, Cancer 101, a number of different other organizations represented, and they gave their expertise and time to really figure out who our top 3 entrants were. And so when I look at our 3 entries, I'm also excited about phase 2, because that's where we really want to see what kind of input these applications are going to get to help them really address the needs of cancer survivors over the course of phase 2. And it's that notion of co-design, that MedStarter, that Health Tech Hatch, that really this whole idea of crowdfunding for us in the department, it's an experiment. We want to see, does that additional metric of input from the crowd for these applications, is that going to elevate them? Because we'd love to see them succeed and really do address the needs of cancer survivors and get commercialized.
So to me, what's very interesting is that you are involved in a couple of things that are new, relatively new. One is challenges. I mean, I didn't know about challenges until I started hanging out with, the health tech type of people. And the other is crowdfunding. You put these two things together. So Adam, can you say a few words about how this is being received in Health and Human Services? I had a chance to talk to Brian Civic earlier, and I kind of made a joke that this entrepreneurship and this innovation and government, really in the past we would have said that's kind of an oxymoron, and now we are looking to HHS and ONC for, if not the innovation itself, the strong arm of support for innovation.
Sure. Well, this has all been really exciting. We see the first few challenges that we ran were pretty basic in the way that they're constructed. We had a problem that we asked people to solve, and they sent in their applications and their solutions, and we evaluated them and sent them off back into the world with trying to promote them and make sure that they were sustainable over time. But I think that the crowdsourcing aspect is kind of the next stage in the evolution of these challenges. They incorporate public feedback, co-design, support from actual patients and actual consumers. And I think that kind of stemming off of one point that Alex made about the, I think, 1.1 million Twitter impressions that have been made about this challenge, means that a lot more people are aware of these challenges outside of just the developer and innovation community. And I think that as we continue to engage all of these people, that means that we're going to get even better co-design, and these solutions will have an even better chance of living on into the future and becoming fully viable, sustainable companies.
Last word, Alex?
Well, I don't know if it's the last word, but
We just got that to say.
so the amazing thing is that when something is crowdfunding, you can speak to this too, Pat, is that when they do succeed in crowdfunding, they've got built-in customers, right? So they've got beta testers, they've got people who are interested in using the application, they've got feedback for the co-design aspect. Co-design basically means, you know, partnering with your customers to design something that they truly love. And, you know, if you make something and people don't like it, it doesn't matter, right? I mean, so a lot of challenges and hackathons come up with something that nobody's ever going to use, right? So I always go back to the Fred Trotter example. I mean, he created this product called DocGraph, and he managed to get 24 really great customers at the same time. Does he need to go for venture now? I don't know. But he has a viable product and he's got a great company. So, and that's the kind of thing you can do with crowdfunding when you do it with the I don't want to say kickstart, but with the help of ONC. You know, you have $30,000 going to be contributed to your idea if you get enough people involved in it, and customers and all that. And it's a beautiful thing. So I'm getting the high sign, so I will be stopping talking.
And so I want to thank the three guests, Adam and Abdul. And,
I would like to thank-
And what's your name? Oh, yeah.
I would like to
Alex,
thank ONC and NCI and the U.S. government, HHS, and Brian Sivak and Todd Park, who introduced us all. And thank you.
And I would like to thank the crowd, because that's what we're talking about here, is engaging the crowd. So thank you very much for a really, really interesting panel discussion. This is Pat Salber from Health Innovation TV.